cats that look like this one. I really do. See, she's got a very good internal mammary. She's got a very good vertebral, costocervical, fibrocervical, axillary. Where are you, Clint? Where's Clint? He want me to show him the axillary. All right. So here's on this one. There's vertebral, costocervical, fibrocervical, then axillary right here. Now look at this. She's got a very good subscapular. There's a subscapular right there. And then this thing right here, of course, obviously is the brachial. And then down in here, the big one down there is the radial. Now on hers up in here too,
we don't have a lingual.
You don't have a lingual. Okay, that's the only thing. And down in there, though, that big one, I can say posterior auricular. I can say the little ones right there. What did I say? The labial. Okay, labial. And the lingual would come up this way. And then right in there, a little anemic looking, but right in there is where we would look for the superior thyroid. Okay, and what were you asking me specifically?
Well, we wanted you to kind of inferior mesenteric, do the veins, and then
the veins. Okay, veins. Yeah, veins. No, but you know that's just kind of the way it goes. There's the superior vena cava. There's the sternal. Now your brachiocephalics are broken off.
Okay, they would just like.
They would, in other words, they would go this way. Another one would come off right here. Brachiocephalic that way. Brachiocephalic. Then external jugular, then subclavian, if they were there. And then right here, down this way is the azygos, which I always ask. The azygos. All right. And veins, you're saying veins? You
like under the stomach.
Yeah. Okay, let's see what it looks like.
Like arteries, yes.
Arteries too?
Yes.
At all? Okay, yeah. All right, see, here it is. Hers looks pretty good, actually. I mean, there's obviously the celiac, superior mesenteric, and coming on out into the, well, if we find a good one, usually I find there's several branches of this thing that can be classified as splenic or splenic.
Yeah.
You just see something going into the spleen, it would be splenic.
Yeah, like whenever I looked at the spleen, I saw some on this side, but it does, like that one.
That would be one, yeah, that would count. That would count. Just anything red going into the organ, that would be like splenic or splenic, either way you want to say it. Now, I don't really normally ask the hepatic and the gastric.
Oh, good.
But they come off if I don't usually have good ones. I just don't ask them. But I do like to do the adrenal lumbar right here. The adrenal lumbar with the phrenic. And I do, of course, these are so easy, right? If I ask you renal vein, renal artery, inferior vena cava, and then of course down here I nearly always do this one. I nearly always do this inferior mesentery. Inferior, yeah, all the way up. It branches. It has several little tributaries off, but the branch that I would go for would be superior hemorrhoidal and colic. Okay. And then this thing down here, then this thing down. Now yours is one that had a good ureter too. I wish I had a bunch of cats like this, Shanna. I mean, I really seriously do. A bunch of them, my life would be easy.
Yeah.
It really would, as far as penance. It seriously would if I had a bunch of cats like this. Because see, she's got a good ureter. She has on this male. There is the vas deferens. Right there is vas deferens, and on that side. She's got a good, on this cat, the iliolumbars. And this is more, sometimes the iliolumbars come off right across from one another. And this one you didn't, and that's okay. Now down in here, down deep, going deep is where we look for the,
I don't think you ever
look for a caudal. And sometimes you can see the branch in the caudal going deep. But right here's her external iliac. Of course, down there, if we had it branching, internal iliacs and caudal. All right, so external iliac, deep femoral, right there, femoral, saphenous vein, and anything behind the knee that I might ask, going back behind, would be popliteal. Popliteal behind the knee, and saphenous vein. I nearly always do the saphenous vein. I mean, those things are that's pretty obvious. Now, you cut open your stomach, and that's good. See those folds in the stomach? That is rugae. Yeah, rugae and whatever. All right, and then I will do these gut questions. The gut questions are, they're just usually those are fluff questions. I usually use those as fillers. A lot of times I'll come in, okay, well, I've already asked some of this stuff. Okay, diaphragm. All right, right medial lobe, left medial lobe, left lateral lobe. Excuse me. Then down in here, the right laterals, both of those. I usually many times do the caudate lobe, that little finger-like projection. I many times, nearly always do the duodenum. Nearly always do the pancreas. Nearly always do the pancreas. And nearly, I have done the cecum. I've done that a lot, the cecum. The cecum is the first part of the large intestine. Ileocecal valve area, if I stuck it in between right down there. Of course, we don't worry about ascending, transverse, descending colon. Rectum is down here. Urinary bladder, I've done something as simple as the bladder, the kidney. Those are just easy, pretty easy stuff. Lung. Now, one thing also on these things, and she's got, again, a good cat. See down under here, we're not going to mess up the vessels at all, but down under here, that thing right under there, that tube right there is the esophagus. That's the esophagus, of course, obviously sitting on top of it. The ring structure, the trachea. Okay, so that's kind of the way that.
Anything in the mouth?
No, I don't think I really have the frenulum. I don't think I've ever. If I've ever asked anything in the mouth, I don't remember it. Just in the. And that pretty. Now I probably will do a radial artery. I will not do an ulnar though. But down in here, any big artery down in here is the radial thing. Now Shanna's cat also has a good pulmonary artery. I need to find more cats with pulmonary arteries too. Because see, I just have this one cat that has all this stuff real good. Okay, because that demo cat didn't show the pulmonary artery like this one did. But I nearly always do the pulmonary artery on the cat. In the beef. To what now?
The girl cat. What do you ask?
On the female cat, about all I do ask on the female cat is the About all I ask on the female cat is the ovary, the uterine tube, the uterine tube, uterine horns, uterine horns, and the ovary. That's really about all I. That's about all I ask on the female cat.
What are you gonna?
Sometimes, I didn't mean to interrupt you. Sometimes on the female cat, though, you can see a little red artery going right out to the ovary. That would be ovarian artery, just right where it's going.
What are you gonna ask on the heart?
On the beef heart?
Yeah.
On the beef, yeah. There's gonna be at least 4 questions on the beef heart. At least two hearts. And I like to do chambers and valves. Like for example, okay. Cardae tendineae, remember that term? Right atrium or right ventricle, left atrium or left ventricle. I like to do the mitral valve. I like to do the aortic semilunar valve. Sometimes the tricuspid chambers and valves are all.
And that ventricular septum.
Ventricular septum, maybe, but I'd probably do valves first. No, I'll tell you something. The chambers and valves, that'd be the main thing on the heart. Now, you do know the apex, see down here is the apex. That's apex, up here is the base. I don't usually do a coronary. We're going to talk about coronary arteries today in lecture. I don't usually do coronary arteries.
What about the endocardium?
Endocardium.
All that.
Now, on a cat heart, if I were to pin, and that's a good one because some of the cat heart, now this one's got, and that's good you did. Sometimes we can do the pericardium, the parietal pericardium. Yeah, pericardial sac. Okay, but there's an outside chance there. But usually, I'm telling you, the high priority are chambers and valves. Yeah.